hyperhidrosis. Did I get that right?
That's right.
Otherwise known as excessive sweating. It affects a lot of individuals. Here to explain this more is Dr. Cynthia Henry from Apex Skin. How are you today?
Doing great, thanks.
Now, you look cool, calm, and collected, so I'm going to assume you don't have any hyperhidrosis.
That is true. That is true, but it does affect a lot of the population. Actually, about 3% of individuals do have hyperhidrosis, which is defined as excessive sweating more than or out of proportion to environment and exertion.
Does it affect men more than women, or vice versa, or any age group differently?
It can affect any gender and all different ages too.
All right. So would you develop it at an early age, or is it something that might just occur as an adult? When would you find out you had this?
It can happen at any age, but I would say more commonly it happens around puberty, and then it's something that can be lifelong.
Okay. And what can you do to stop it? Is it diet, or is it treatment? What do you have to do?
There are treatments for primary axillary hyperhidrosis, which is underarm sweating, which is the most common. There are treatments. You can do topical treatments. That's the first thing we try.
Okay.
There are medications that can be applied to the skin. After that, then there's Botox, and there are oral medications that can also be used.
All right. So I don't want to, make sweating the evil thing in the universe, because sweating does help cool the body when it's done properly, right?
That's right. Yeah, it does have a thermoregulation importance. So it is necessary. What we're talking about is when sweating is excessive over what you would expect in certain situations.
Are there people who are the opposite of hyperhidrosis, where they don't sweat at all, and that causes them problems?
That is actually a very terrible problem also, yeah. Much more rare, but yes.
Okay, so if someone comes to you and they say, I've got the hyperhidrosis, you go through the steps, what's the success rate of getting them to the point where they can go out without being embarrassed?
It's very individual. Some people respond better to some medications than others. As I mentioned, we do start with topical treatments. Sometimes people have enough improvement that they're happy to stay there. Other people, we have to start using oral medications along with the topicals. We also talk about using Botox, which relaxes the muscles in the sweat glands to reduce sweating temporarily for about 3 months. So there's a stepwise approach, and we do continue to work with patients until we do get that improvement that they're looking for.
It's a double whammy for them too, because in addition to having this, it's the type of thing where a lot of people don't, instead of feeling sorry for them, it's very embarrassing, I'm sure, for them, and then people are making fun of them and that kind of stuff.
Absolutely. It is associated with anxiety and depression. So it's a vicious cycle where people are in professional settings where it's quite embarrassing, or even in social settings where they want to, not be worrying about that. They want to have, fun or do their job or their careers. All that is very important. So it can be very debilitating.
All right, and there's nothing they need to do in the way of changing diet or anything like that?
No, we've not found any dietary changes that can affect it.
All right, you have an event coming up, right?
We do, yes. Next Wednesday, 4 to 6:30 at our Westlake office. We're having our first anniversary of that office opening.
Okay.
And we're going to have some demonstrations, different talks, and we're going to do our best discounts of the year.
All right, sounds good. Thank you, Dr. Henry.
All right. Thank you.
All right.